have frog, scientific name Rana tigrina from chordata of tetrapoda superclass and vertebrata subphylum. So let's begin this. So here is already given classification how this is classified. So phylum chordata, group craniata because contain cranium. Now craniata contain vertebrata subphylum. So in vertebrata division is gynostostomata, and gynostomata means jaw present. So for gynostomata what jaw is present, that is called what gynostomata. Tetrapoda means appendages for. Amphibia, this is class. Order Anura means tailless frog. Now genus Rana and species Tigrina. So here is given what difference between frog and toad. So difference between frog and toad can be illustrated below. Frog is what diurnal, means it activates at day, and toad is nocturnal, at night activate. This is aquatic, this is land. Now frog skin is slippery, it's rough, and it contains poisonous gland. It also contains gland, but this contains what toad contains mostly poisonous gland. So parotid gland is absent. Here parotid gland present. Lower jaw is triangular, lower jaw is semicircular. Now tongue is bifurcate. Now tongue is entire. So tongue is like bifurcate means what unfolding the tongue will stick the snake, stick the insect, and then fold it back to the mouth. Now, upper jaw, lower jaw without teeth. There are no teeth here. Now hind limbs well webbed. For what? Well webbed is for swimming on the water. Now here hind limbs well webbed and flexibly, but here is skinny. Now vocal sac is present. Now vocal sac is absent. So vocal sac in frog is present to make what sex contact or copulation, that is amorphous means false sex occur in frog, and male has what that vocal sac for attracting female. Now internal vocal sac is present, here not present. Now omosternum is present, omosternum is not present. So omosternum is for what the bone. Now egg or leg irregular, here egg lay in chain like form. So distribution cosmopolitan is found in everywhere. Now given habit and habitat. So in habit and habitat is amphibious, means in land and water both. Breeding season, in breeding season they go in pond, and in pond they make what copulation, they make sex contact and lay egg there. So feeding behavior is tadpole is herbivorous, adult frog is carnivorous, feeds on spider, insect, worm, larva, etc. Now it is also cannibal. So female frog can eat male frog during the sex contact between them. Now prey is generally caught alive here and captured by this sticky tongue. I have told you that tongue is like bifurcate. So unfold the tongue and catch the insect and then fold it again to the mouth. Now locomotory organ, in it swims in water, leaping, jumping and walking. Breeding behavior. So breeding behavior is for the sexual contact. So for sexual contact, croaking sound is is croaking sound is made like ko, and copulation with oviposition, like oviposition, and croaking sound in male frog only. So vibration by vocal sac. So it is a advertisement of advertisement of home and husband. So amphibian is a cold-blooded animal, as we all know that only birds or ape and mammals are warm-blooded animal. Here, here we have what two sleeps. So frog makes two sleep due to cold-blooded animal. So maintaining body temperature in winter, so make winter sleep, that is called hibernation. In summer, his summer sleep, that is called estivation. Now external feature of frog. So how frog look like and how can we differentiate frog? So according to shape and size, first bilaterally symmetry, spindle shape, and streamline, which lack neck too. Now here no exoskeleton, skin are smooth and slippery, slimy or slippery. So no exoskeleton. Now no exoskeleton age. Frog also make respiration by skin, that is cutaneous respiration, and body surface will also make what slippery to escape from the enemy. Now body division here occurs into head and trunk, because no neck, we should say what, no neck is found in this frog. No neck, no ear. So in head, that is what boat like shape, you can say, or triangular shape, which bear mouth, eyes and eardrum. So no ear, also eardrum here, and mouth is what, like large, mouth is large and semicircular with external nares, which is found either side of what, a snout, and eyes are what, bulging. So eyes are bulging and immovable upper eyelid. So bulging and can move what, can move in all direction. So in eyes they can move in all directions. So nictitating membrane also present in lower eyelid, so for movable and function. So nictitating membrane helps in what, water for protection and see in water. Now no external ears here. Now it contains tympanian membrane and cartilaginous ring. So here brown spot is located as what, third eye, that is ancestors of frog eye, you can say. Now trunk, let's move to trunk, because neck is absent, so move to trunk is what, dorsal hump. So contain two pair of limbs as tetrapoda. Now upper arm, forearm, hand contain, the hand contain palm fingers, so there is no thumb or pollex. Inner now in male, inner finger has what, cup exemplary pad for catching female frog for sexual contact. And for sexual contact, this will be the holding. A pair of hind limb. So in the hind limb we have what, femur, shank, foot. Now in resting stage, hind limb like what, jet shape, which help in swimming, jumping. On ventral surface there are what, subpetural pad. Now tail is absent, so this group is called anura. Now we have what, skin given. So in skin is like thin, smooth, without scales, and metachosis. So metachosis is hair that is changing skin color for protection. Now skin has if contain what epidermis and dermis. So in epidermis contain layer like corneum, which is the outer layer of epidermis, and consist squamous epithelial cell in 4 to 5 layers. So it will make for pattern is for protection because of keratinized cell here given. So keratinized cell, and also cast over. This is for what? Molting or ecdysis. So this is for ecdysis is for in the adult molting. Now stratum germinatum or Malpighian layer. So it is the inner layer of epidermis, has contained columnar cell with elastin eladin waterproof chemical eladin, and hardens from keratin. Now dermis. So this is the second layer of body which is inner to the epidermis. So formed from what? Mesodermal in origin, divided into stratum spongiosum that contain chromophores and poisonous gland with mucus gland here. And this is like 3 types: melanophores brown color, cyanophores yellow color, guanophores white color. So intermediate. Now stratum compactum. So stratum compactum contain collagen fiber. Now function of skin is protection and respiration, permeable to water. Now whole of trunk. Now let's move to trunk. So whole of trunk contain xylem. So trunk contains xylem and because of visceral peritoneum present here in is like abdominal region start from the trunk. Now food. How food is passed. So food contain carbohydrate, protein, fat, monosaccharide, amino acid, this you should remember. Continuing to digestive system. Now alimentary canal. So alimentary canal is very long, but adult is what? Carnivorous. So not very long. So sorry, not very long, because carnivorous animals all have what? Short alimentary canal. But due to digestion of what? Protein, and if herbivorous animal, then long what? Alimentary canal for the digestion of cellulose. Now here is mouth, which is terminal, horizontal, and what? Which shape? Like moon shape or semicircular shape. Lower jaw is what? Movable. Bacopharyngeal is no teeth on lower jaw. And upper jaw with teeth, maxillary teeth, with a vomerine teeth also. Now dentation is DTH. Now no HAP means homodont, acrodont, and polyphyodont. Polyphyodont means many set. Acrodont means attached to lower dont, and homodont is what? All like same. Now dental formula. Dental formula is here absent. Now tongue is large and bifid. Told you test papillae present. Now darting tongue is due to proctile, retractile, hypoglossal muscles, presence of lymph in sublingual, lymph sinus, proctile, retractile taste words are absent. Now terminal region. Now so terminal region depression. So in the terminal region of the teeth, upper jaw has depression, subrostal foci, in which vomerine teeth get these 3 vomerine teeth get attached there by the tight closing of mouth, and male vocal sac is present. No digestive takes place due to what? Absence of salivary gland in him. Now oesophagus is broad. It's secreting gland. It is what? Inactive enzyme, and it have pepsinogen For what? So for what? For making protein digest. Now stomach has 5-6 centimeter, and entire cardiac part which contain gastric gland. Now gastric gland like peptic or zymogen, chief cell secrete pepsinogen. Now pepsinogen in HCl present activate pepsinogen to pepsin. Now protein digestion takes place by the pepsin to peptones and peptidases. Now oxyntic cell also present secrete HCl. Mucous cell secrete mucus. Now stomach perform three functions, that is storage, mixing and chemical modification. Now small intestine differentiate and then duodenum and posterior ileum. Absent Barnard's gland and crypts of luberculum in the small intestine. Now duodenum U-shaped hepatopancreatic duct here, and absent of ampulla of belly and the sphincter of OD of from what? From pancreas. Now ileum here, ileum contain what? Villi for the absorption and secreting, and intestinal gland secreting intestinal juice, that is succus entericus for digestion of protein. Now rectum. So rectum here is function is absorption of water, and cloaca is the last common chamber. Cloaca is a common chamber where rectum, ureter, oviduct and urinary bladder opens. So here opening of rectum is into cloaca is called what? Anus. Now digestive gland. Now digestive gland is liver, that is largest in the body, divided into three lobes, right, middle and left, with gallbladder also. So gallbladder attached to liver by what? Cystic duct, and that come into in pancreas to form hepatopancreatic duct. Now contain lobule tubule, and liver receive what? Blood from two sources, that is hepatic artery and hepatic portal vein. So artery receive oxygenated blood. Now bile salt. So bile salt is here, that secrete sodium taucolate, sodium glycolate and sodium bicarbonate is absent. Bile pigment is present at bilirubin and biliverdin. So bile pigment doesn't contain any digestive enzyme. Function of liver is alkaline juice, which help in emulsification of fat, store glucose, that is glycogen, by the process of glycogenesis, convert protein into urea, and during embryonic stage it produce what? RBC. So in tissue chapter we have studied that from liver we can form what? RBC, then spleen, and then to bone marrow. And but is first is what? Yolk sac. Now continuing to liver, it stores what? Copper and produce vitamin A. Prothrombin and fibrinogen is also mainly essential for blood clotting, and that is also synthesized by liver. Heparin checks the what? Coagulation of blood with the blood vessel. So heparin is for anti-clotting. Now pancreas. In pancreas is the second largest gland of the body. It is mixed gland. Histological consists of cluster of cells called as acini gland. So in acini, three special enzymes: trypsinogen, amylase, and lipase. So you can remember by TAL, trypsin, amylase and lipase. So trypsin is for protein, what? Protein digestion. Amylase is for carbohydrate digestion, and lipase is for fat digestion. Now isolate now endocrine. That was exocrine from the acne. Now endocrine, so from endocrine isolates of Langerhans. They secrete two hormones, that is insulin means decrease glucose level, and glucagon means increase or convert to glucose. Frog has what? Intestinal spleen. Now come to respiratory system. So in respiratory system, mode of respiration is what? Mainly cutaneous, from skin, bacopharyngeal, and one what? And what? Alveolar respiration. So first, cutaneous respiration by the skin, which contain dirt mist that makes act as alveoli for what? Getting oxygen. Now it is total 30% outcome is intake of oxygen, and if you just pull out the skin from the frog, then it will finally die. That is called asphyxia. Now second type is bacopharyngeal respiration. Now this takes place in the bacopharyngeal cavity, where mouth, glottis and gullet is kept closed and nares are what? Open. So nares is the important here for this type of respiration, and this is during when they are resting position. So this is in the resting position, and that was for what? Hibernation and estivation, means summer sleep and winter sleep position cutaneous respiration. It acts at 5% of intake of oxygen. Our third type is pulmonary respiration, in which involve what? Lung alveoli contain two number of lungs and account for 65% of total intake of oxygen. Also frog has this more used oxygen, that is 65. So organ involved here is external nares olfactory chamber, internal nares bacopharyngeal cavity, and glottis. Now laryngeal trachea. So laryngeal trachea is called sound box, that is sound producing organ. This present on male frog, that is vocal cord. This consists of what? Three cartilage, that is a pair and one unpaired. Now here is no thyroid cartilage, so absence of thyroid cartilage, this is also main. So like things like absence is ear, things like neck, this type of absence should be remembered. Now lungs. So lungs are, there's a pair of lungs without lobe. Each lung has outer peritoneal wall, middle connective tissue, unstratified, inner irregular septa, large number of small air sacs called as what? Alveoli. That is alveoli makes what? Exchange of gases or respiratory center. Now respiratory organ. So respiratory organ center is medulla oblongata, and this takes place when the external nares frog valves are closed. Now ventilation is for what, taking in and making out. So this is for taking in oxygen and out CO2. Like so two type of muscle involved here, that is steroid muscles and pectoral. So in sternohyle, if contraction, then lower of the Bacopharyngeal cavity, the increase inspiration. So INS ins, you can say. And pectoral muscles, when contract, then raise. This will raise. Sternohyle will lowers, but if contraction in pectoral, then it will raise Bacopharyngeal, so result in expiration. Both sternohyle and pectoral muscle contract 2 times for one complete pulmonary respiration. Now we have got invertebrate respiratory process occur in 3 stages, that is breathing, gaseous transport, and biological oxidation, means internal respiration or tissue as tadpole. So first go for tadpole. Tadpole is what, aquatics, gill breather, can't survive without water, so it is fully aquatic. External gills 3 pair, internal gills 4 pair, and gill pouches is 5 pair. This is also important. Now we have circulatory system. Next from respiratory system. So circulatory system is here closed system, means within a vessel the blood is pumped and circulated, consists of 2 subtypes, that is blood vascular and lymphatic, two type system. So in blood contain heart, blood and blood vessel. In lymph contain lymph sinuses, lymph vessel, and lymph heart too. So here lymph heart is also present. This is important. Now blood vascular system contain blood, which is mobile connective tissue, contain 2 parts, that is plasma and blood corpuscles, means formed element. If you have studied in tissue, then you animal tissue, then you should have remember that. So 3 type, that is erythrocyte, leukocyte, and thrombocyte. Erythrocyte is RBC, which is oval, nucleated, and biconvex. Now leukocyte is colorless and has 5 type. Is phagocytic and produce antibodies. Thrombocyte is take part in what, blood clotting, is called what, platelets, you can say. Now heart. So heart is triangular like muscular and covered by pericardium, means cover of the heart is pericardium. Heart is 3 chamber here due to amphibian nature, and interauricular septum between 2 auricle present. Now coronary sulcus is for what, ventricle division. So like this, if like this is heart, then it contain what, 2 chamber, and this 2 chamber auricle. So this is called interauricular septum, and 2 auricle septum from now this ventricle. Now this is called what, sulcus. So horizontal is called sulcus and vertical is called auricle. Now guarded by 4 flipped auricular ventricular valves. 2 auricle. Now here this valve is like this. So this valve is made from like this thread type of tissue that is called cordi tendini. The ventricle fissure and ridges are called columni corni. Now sinus venuses. On the dorsal side of heart, the sinus venuses is a triangular sac, and it receives three vena cava, two precaval and one postcaval. It open what? Right auricle by sino-auricular aperture guarded by two sino-auricular valve, and frog blood flow from right auricle from sinus venosa. So from here, if this is heart, then from here blood what flows from this. Now truncus arteriosus is on the ventral side. This is on the dorsal side, and truncus you can remember by TV type. TV trick here. Truncus arteriosus. This is on the what ventricle, like down, like here, like this down ventricle. Now this contain, now cornus arteriosus is the pygidium in the truncus arteriosus, and distal portion is the what proximal portion, and distal portion is synagium or ventral aorta, also called as bulbar arterioles. Distal is the bulbar arterioles or synagium or ventral aorta. Now pylegium. So pylegium is the spiral valves hood guarded on the right ventral cavum aortium and left dorsal cavium pulmonocuteum. Now we have next syngatium is completely divided by horizontal portion called as what? Septum. Now syngatium into left aortic and right aortic trunk. Now each aortic trunk contains this three type of artery: carotid artery, systematic artery, and pulmonary artery. Now how this working? So three semicircular valves present in the pygidium between and syngatium. Between the pygidium and syngatium, the heart working by the cardiac cycle complete in 0.94 second, and frog heart beats 64 times in a minute. The first contraction of both auricles, so contraction of both auricle will open what? Open auriculoventricular valve, and deoxygenated blood from right auricle pass from left auricle to ventricle. Now contraction of ventricle. In contraction of ventricle, yes, a valve what? Open, and closure of AV valve, opening of semicircular valve in truncus arteriosus. Now here that is called what? Labium. Blood vessel. So blood vessel here also three types, that is arteries, capillaries, and vein. So arteries are carry pure blood, and here no valve present. Capillaries are like hair like blood vessel, connect what? Arteries and vein. This is the intermediate connector. Now vein collects what? Impure blood with have semi-lunar valves present many. Now arterial system. Now arterial system from the truncus arteriosus divided into two branches. So one is carotid, and other is pulmonary cutaneous. So each carotid will give what? External carotid and internal carotid. So external carotid supply blood to tongue, and white means tongue, and internal carotid arteries into what? Three branches. So make clear here, in the heart of frog, sinus venuses is present, so that flow to right auricle, and And ventral side contain what? Truncus arteriosus, which contain what? Which contain conus arteriosus, pygidium, and distal portion pygidium. So pygidium we have studied here how this pygidium contain left trunk and right aorta. Now next. Now in arterial system, ophthalmic supply to eye, cerebral supply to brain, palatine supply to bacopharyngeal cavity. Now origin of internal carotid contain carotid labyrinth detect partial pressure. Now the middle one is systematic arc which contain of all of the largest branches from systematic. We have esophageal occipitovertebral artery, subclavian or brachial artery. So in the systematic artery esophageal, from what carry blood to the vertebral column, arterial to the vertebral column, and subclavian from blood to the supply blood to the what? Shoulder and fourth limb. And next is what? Next is squelic artery that contain gastric artery supply to stomach, hepatic artery supply to liver. Now, anterior mesenteric artery divided into three branches, that is intestinal artery supply to intestine, splenic artery supply to intestine and spleen, duodenal pancreatic artery supply to duodenum and pancreas. Now we have got what? Dorsal aorta. Now dorsal aorta passes backward beneath the kidney, means down the kidney, along what? Mid dorsal line, and gives 4 to 5 renal arteries to kidney. Now each iliac artery gives the three branch, that is epigastric artery supply blood to muscles of thigh and to the urinary bladder. Epigastric. Now femoral supply to the thigh. First epigastric supply to what? Thigh and urinary bladder, and femoral to the anterior part of thigh. And the sciatic artery supply to shank and foot. Now we have pulmocutaneous arc. So pulmonocutaneous arc contain two artery, pulmonary artery supply to lungs and cutaneous artery supply to skin in the pulmocutaneous arc. Now venous system. In the venous system brings blood from various parts of the body to the heart. This venous system consists of pulmonary vein, systematic vein, and portal system. So systematic vein contain two precaval and one postcaval vein. Now pulmonary vein. So pulmonary vein bring oxygenated blood from lungs. So pulmonary vein is from lungs to heart. So this pulmonary vein, left and right pulmonary vein unite to form common pulmonary vein and opens into left auricle. So opens into what? Left auricle. This is done. So first this is done to left and right because of two lungs. So these two lungs will give what? Oxygen to veins. Two lungs and two veins give the oxygen to one veins, and that output will be secreted on the left side of the heart of the auricle. Now systematic venous system contain external jugal from the lingular, contain what? Tongue and mouth, mandibular to the lower jaw, innominate to the innominate content also too, that is subscapular to the arm and shoulder. Internal jugal contain inside the skull. Now subclavian on the brachial from forelimb, and musculocutaneous to from the skin and side of the body. Now postcaval begins between kidney and pass to the liver. It ends like the triangular, that is sinus venous, contain component of vein, that is the 4 to 5 pair of renal vein, a pair of spermatic or ovarian vein, and a pair of hepatic vein. We have portal system. So portal system contain what? Capillaries, of capillaries, and connect to the heart, that is called portal vein. And two portal system present, means leaving the heart, the blood is passing, that is called portal. So renal portal system from the femoral and renal portal vein. Femoral, that means lower means outside of hind limbs combined with inner side of hind limbs. So out hind limbs combined to inner side of hind limbs to form renal portal vein. Receive dorsal lumbar and oviduct. Now in this capillary kidney we have a renal portal system. Now hepatic portal system is for what? Liver, contain on anterior abdominal vein. This vessels has a small vesical vein, and liver is fed with what? Blood from hepatic arteries, anterior abdominal vein, hepatic portal vein. Now blood is discharged from liver by the hepatic vein into postcaval vein. Now lymphatic system. So lymphatic system contains lymph vessel, lymph node, and lymph heart. Now so lymph is filtered out colorlessly by the lymph capillaries. It is what? Few leukocyte, means it means lymph is for what? Protection and immuno, you can say. Now erythrocytic and thrombocytic are absent here in the lymph. So lymph are 20 subcutaneous lymph sinus below the skin. A two pair of lymph heart. The lymph differ from blood, that is colorless and no respiratory pigments. Control and coordination. Now nervous system has two, that is endocrine and nervous system. So nervous system CNS, PNS, and ANS. CNS contain outer covering, that is duramen, and inner is pymatter. Part of brain of frog is forebrain olfactory for nose, cerebral hemisphere, cerebrum, main and diaphyseum, midbrain, optic lobe, and cura cerebri, hind brain, cerebellum, and medulla oblongata. Now forebrain olfactory lobe has olfactory ventricles and function control sense smell. Cerebral hemisphere is for cerebrum and has cavity. Lateral ventricle means paracel. Now another is foramen of Monro is into what? Diocele or third ventricle. Now diencephalon. So diencephalon is also called rhomboidal structure, means third ventricle. Contain optic chiasmata and pulmonary pituitary body with a pineal body here present in diencephalon, that is called as third eye. Now function of diencephalon is for metabolism of carbohydrate, protein and fat. Now midbrain contains optic lobe and cura cerebri. So optic lobe is contain corpora bigemina called as optocele. So this is for what? For vision. Optic lobe control what? Sight means vision. Now cura cerebri is the connection between cerebral hemisphere and medulla oblongata. So this is the connector. Now hind brain is the third type, final type, that contains cerebellum and medulla oblongata. So cerebellum main function is for coordination of body, means what? Stabilization of body in the equilibrium position when moving. And medulla oblongata contain what? Metacele or fourth ventricle. So fourth ventricle occurs in medulla oblongata, and its function is control involuntary activity and reflex action. Now a spinal cord. So a spinal cord on the posterior region of the brain. Now this has urostyle. This contain what? Urostyle, tapirs and cauda equina. Now gray matter here extend into dorsal and ventral root of spinal. So dorsal root is what? Dorsal root is main connectors on the spinal. Now peripheral nervous system, PNS, we can say, contain cranial nerves. So frog is amphibian, so contain 10 pair of cranial nerves. That is, last two is accessory and hypogeial. So accessory for holding and hypogeial is for tongue, you can say. Now spinal nerves is what? Mixed nerve, means both sensory and motor both. And number of nerve in brain is 10 pair. Now 9 pair in the rana trigeminal spinal nerve. ANS, autonomic nervous system, contain two part, that is sympathetic and parasympathetic. So sympathetic has what? Sympathetic has vagus nerve, and this work on the what? On the excited level. And parasympathetic nervous system contain what? Acetylcholine, which has opposite in function than sympathetic nervous system. Now we have a sclerotary system. So sclerotary system here consists of sclerotary system, that is kidney. So here given a pair of kidney. So kidney is subvertebral limb sinus, and two kidneys of same level, not in like mammals, up down, due to heart. So kidney has nephrons, Bowman's capsules, which is called glomerulus and Bowman's capsule, together from Malpighian body. Now unifibrous tubules here connected with what? Bulbar canal, Bidder's canal, nephrostomes, ventral surface. Reproductive system given. The first reproductive system is for sexual system. So there is what? Sexual dimorphism, means you can distinguish between male and female frog by seeing physical appearance, and also vocal sac and amplexus pad in male, that makes highly what? Visible of the male character. And amplexus is term, that is what? Pseudo copulation here occur, because actual sex is not happening, so that is called what? Pseudo. Now Now tunica albuginea in the testes surrounding cells of Leydig present here. Tunica externa on the stoma of ovary. Now cell of solitary or nerve cells is the supporting or nourishment cell. Mesorchium that connect what testes and kidney. So this is also important. Mesorchium, Leydig cell, that is connective tissue between testes, and we have what mesothelium is for ovary. Follicle cells protect the nerve cells and the oocyte of ovary. Now yolk is what telolacethal, remains downward in water. Animal pour head in oviparous. Now fertilization is external and holoblastic. Development is indirect and tadpole larva. Tadpole larva is herbivorous. Yolk plug is formed during gastrulation. Now, archenteron, if embryogenesis, then archenteron is developed. We will see archenteron and blastocyst, blastocell in the developmental biology. Now sex hormones are here, that is steroid derivatives, and female only estrogen hormones, no progesterone hormones. Thyroxine hormones here present, that is on the for the complete of metamorphosis. So if thyroxine is removed from the frog, from the tadpole state, then that tadpole will not develop to frog, and that become aquatic. Now skeleton system, skeleton two type. Exoskeleton is absent due to what? Due to skin respiration or cutaneous respiration. So exoskeleton was previously present in all, like in invertebrates, insect contain insecta class contain chitin. Mammalia also contain what? Hair, hoof, nail, horn. Bird contain feather and claws. Fish contain scales. Now endoskeleton, but the frog doesn't contain what? Exoskeleton. Now endoskeleton in all vertebrates made of what? Bones and cartilage. So endoskeleton is mainly what? Cartilage. Now endoskeleton has axial vertebral column and skull. Appendical skeleton contain limb and girdles. Now axial skeleton, skull of tadpole is cartilaginous due to what? Embryonic, because tadpole is like embryonic type, and below neurocardium there is what? Visceral skeleton. Skull of adult frog is dicondyal due to what? Due to two opening and triangular and broad divided. Now cranial skeleton include occipital segment, contain two occipital knob, that is called occipital condyle. So it is called what? Dicondyal. So two opening, I have said you, two opening on the foramen magnum. Now cranial segment contain sphenoid, parasphenoid and frontoparietal. Now auditory capsule is for the ear, that is, but ear is absent, that is what? That is the main capsule. So auditory capsule, preaortic, columnar oris and steps. Olfactory capsule contain nasal, vomer and steptomaxillary. Visceral skeleton present, that is upper jaw, premaxilla, maxilla and quadrijugular. Lower jaw or mandible contain Meckel's cartilage, dentary, angulosphenoids and metamarcum. Jaw suspension and hair, and no teeth on the lower jaw. Now jaw suspension is squamosal bone, palatine bone, rod shaped, and pterygoid bone that is Y-shaped. Now platybasic. So platybasic skull is platybasic between two eye orbit, and skull is autostelic, means they can move head to the 360 degree, that is called autostelic. Now wide aperture for the, you can say, bone of tongue. Now here not seeing now hyaline cartilage on the basilical plate and contain what? Contain two anterior horns, two process, two posterior vertebral column. So vertebral column are contain like centrum, transverse process on either side, zygophysis, and not viewing clearly. So ribs are absent in frog and contain two portion, sternum, that is omosternum and merosternum. So omosternum will be what? Episternum, and posterior mesosternum is xyphisternum. So epi, omo, meso, and xyphisternum. Appendicular skeleton is consists of girdle and limb bone. So girdle, pectoral girdle has two regions. A scapular region contains suprascapula and scapula. Coracoid region contains clavicle, coracoid, precoracoid, and epicoracoid. Now pelvic girdle. So pelvic girdle is V-shaped. V-shaped uses os innominate, and os innominate contain illum, pubis, and ischidium. We have left for vertebral column due to non-visible. So we will continue later. Now iliac crest hair present. Pubis is hair triangular piece of calcified cartilage. Ischidium is larger. Now acetabulum is present, consists of three bone. Now limb bone contain four limb of humerus, radioulna. Now humerus, where what? Head fits into glenoid cartilage. In the hand contain deltoid ridge below the head. Below the head is deltoid ridge and trochanter. Now radioulna contain what? Sigmoidal notch with elbow. Now carpals. So carpals is 6 arranged in 3, that is this and this. Now metacarpal is 5. First metacarpal is rudimentary. Phalanges is 10, and this is the formula 022 to 02233. Now here is given what this carpal. So wrist is called carpal, palm is called metacarpal, and finger is called what? Phalanges. Now hind limb. So hind limb contain femur, that is S-shaped and formed by the what? Calcified cartilage. Fits into acetabulum. Now tibiofibula on the nemaic crest or tibial crest. Presence of foramen, that between tibia and fibula. Now tarsal consists of 5 number of tarsal bone. Proximal rows, calcaneum. Now dorsal has 3 tarsal, like this upper we have same like metatarsal is like 5 number longer, and noid both phalanges is 14 number. Digital formula 22. Now 343 contain what? Prehexular or calcar. Vertebral column. So vertebral column contain what? 10 vertebra. Now ventral rod is called centrum and dorsal is neural arc. Now from neural arc we have transverse process on the both side and neural spine on the middle side of zygophysis. So here pre-zygophysis from anterior and post-zygophysis from posterior. Post is for posterior, easy. So pre is what? Upward and inward. Post is downward and outward. So vertebrates are bound together by what? A strong ligament. Now centra of hair contain what? Ball and socket joint. The total number of vertebrae is 10. I am told the first vertebra is atlas, that is oscillus. First this is oscillus and some are what? Amphicoelous here. So oscillus here and transverse process and pre-zygophysis is absent. Now centrum. So centrum on the what? On the occipital condyle of the skull. Articulation enables what? To move the head up and down. So for first atlas is for move what? Head up and down, and that second was X is to move what? Head to the left and right, you can say. Now 2 to 7 are what? Cartilage typical vertebra. This is also what? This is procellus. First was oscillus and this was what? Procellus. 2 to 7 is procellus. Contain strong transverse process on 2, 3, 4 and have neural canal. Now here 2 to 7 have what? Neural canal. And first atlas have no neural canal. That gaps is called intervertebral foramen. Now 8 vertebra is amphicoelous. Amphicoelous means centrum is concave and 9th is sacral vertebra. So 9th is sacral vertebra, that is oscillus. This is also oscillus with 2 convex facets with the urostyle. Now last vertebra is plouch, known as urostyle, and found by fusion of 2 bone